Now let me introduce our next speaker, second to the last speaker for the day. He is a graduate of Doctor of Dental Medicine, and more importantly, he is a board-certified biological dentist by the International Academy of Biological Dentistry and Medicine in the United States. He is one of the pioneer authorities of holistic dentistry or biologic dentistry in the Philippines, and he is also recognized lecturer, having done scientific discussions on biologic dentistry on prestigious medical and dental associations, both conventional and alternative symposiums alike. Remarkably featured in newspapers and televisions, he heralds safe, health-centered dentistry for the whole family. Please let us welcome Dr. Nelson Marie Gaba.
Good afternoon, everyone. I'm happy to be here and part of the Longevity Conference. Good afternoon, Kuala Lumpur. Good afternoon, Putra. Okay. Today, allow me to keep the door of biological dentistry open as we talk this time around about our search of the root cause of diseases. Next slide, please. Okay, as a disclaimer, I am not connected or part of any company, and I would like to say that I'm a dentist. Please let me know if I said anything that you want to be explained further. And I'm here to engage with you as part of a collaborative team of medical dental or dental medical practice. Very good. Okay. I'm happy to be here. My journey on dental wellness brings me in this place. You see, I am 60. I just turned to be a senior citizen. And one of the great things that happened to me this year, besides my granddaughter, is I play tennis. A new sport. And I'm here now talking about longevity. Okay. It's okay. I graduated 2083. My dad is a dentist. I'm a dentist. My daughter, who's with me, is also a dentist. Okay. The best thing that happened, I would still say at 60, my passion for the profession is still there. So it happened when I was in 2002 a cancer patient came to my clinic. And this cancer patient opened her mouth and said, "Doc, treat me." Well, she went to a dental clinic. I'm a dentist. She's a cancer patient. What am I to do with her? She has breast cancer, by the way. And she told me to do a dental cleanup. So that's what I did. Still not working? Okay. So what I didn't know, what the cleanup she was pertaining to, was to gear away from all the metals and all the toxicity, infection, inflammation in her mouth. She has a clear idea what she wants me to do at that time. But I have no idea at that time because I was still a conventional dentist. Okay. My holistic approach to dentistry is of three important principles. Everything that we do has implications for our body. Everything that we place inside my patient's mouth, the procedure that we do affects the body. Each patient is unique. There's no one formula for everybody. Everybody has its own chemistry. If healthcare practitioners wish to understand the body and healing, we must be willing to explore and learn from new ideas and our patients' responses. We should be open to anything. Today I'll be tackling on the tooth and body connection, the roots of diseases, heavy metal toxicity, compatibility, and treatment protocols. Okay. At this point, I would like to see a raise of hands, please. Who among you are doctors? Yes. And who among you are dentists? Please, I want some dentists here now. Okay. Yay, including my daughter. Okay. The integration of medicine and dentistry is long overdue. A lot of times, doctors will just look at the body or maybe whatever specialty they want to look at. They're looking at the bigger picture. But part of the bigger picture is a small picture, the mouth, that sometimes is ignored. Now, with my fellow colleagues, the dentists, a lot of times we're looking at the small picture. Please look at the bigger picture now. And I'll tell you why. There's a need to bridge the gap between dentistry and medicine. In our country, we're starting to collaborate for one patient, doctor, and dentist. Okay? Dr. Christopher Hazar said, 80% of the patient illness I find in my medical practice originate in the mouth. That's 80. The links between oral infections and diseases were first identified in the 1900s. We just have Dr. Thomas Levy, and he gave a lecture and also concluded that oral infection has to do with a lot of systemic diseases. Caught in the dead end and looking for what's causing your patient's illness or even your own? Or you've done everything and still leaves you back to square one. Could the key be in the mouth? A quick anatomy, if you please. Do an oral examination. When your mouth, you request your patient's mouth to open. This is a molar, a lower molar. You slice the tooth in half. This is what you see. What you see in the mouth is the natural crown under the bone, and the root is the root. Okay? The outer layer of the crown is the enamel. The next layer is the dentine. The enamel is sturdy, supposed to be the hardest part of your body. The dentine are basically dental tubules, where dentinal fluids, oxygenation, proteins, amino acids goes from the inside of the pulp going outside. That's why the tooth is alive. Then under, okay, I have to emphasize these tubules. If you look under an electron microscope, it will look like those straws. But when you sip in the glass, a bunch of straws where there are, spaces inside. And when you connect it, it's about 2 to 3 kilometers. Okay? So dentinal fluids flow freely from the pulp to the dentine. Now, the pulp is basically the heart of the tooth. Our nerve endings bundled up from the pulp chamber and exits to the root of the tooth and connects itself to bigger blood vessel. This is where the tooth is connected to your body. The tooth is a significant part of the body. Whatever you do, whatever you place to the tooth, the highway of transport goes from here and goes to your heart, to every part of the body. So you do not separate the tooth from the body. The tooth is an organ by itself, just like your kidney, your liver, your heart. It has its own circulatory system, lymphatics, stem cell system. That's why it needs to be alive. Okay? When you request your patient to open his mouth, you would usually see something like this. Metals, and sometimes even infection. A conventional dentist would look at this as just, a nickel crown, an amalgam filling, and a gold crown. We cater to cancer patients almost every day, and our patient would ask, what's inside, doc? This metal crown contains nickel, mercury. Amalgam contains 50% mercury, copper, tin, silver, zinc. Gold contains copper, and of course titanium, and fluorosis from fluoride. What you don't see through your eyes, you see through an X-ray. You see mercury amalgams, you see crowns. These are dowel posts. What you see in the X-rays that glows are basically metals. And of course, a root canal, a dowel post, and how the tooth or the bone reacts to those restorations. Mercury, nickel, mercury, this is nickel, chromium, cobalt, aluminum. Nickel, chromium, cobalt, aluminum. Gutta percha contains cadmium. And of course, periapical and abscess or osteitis. Most of us has a porcelain fused to metal crown. Porcelain cannot withstand stress alone, so it has to sit on something that's hard. Ceramic will break, so there is metal. Even though when you smile, it looks like everything's white and porcelain, but it has metal. Metal has nickel, chromium, cobalt. Porcelain has aluminum. Okay? Dental problems that may contribute to patient illness. We have number one, toxicity from dental materials use, particularly heavy metal toxicity, biocompatibility to dental materials. There are sensitivities to dental materials, electrogalvanism, and ion migrations in metal restorations. Root canals as a cause of illness. We're talking about focal infection, hidden bone diseases, infections of the bone, focal infections, relationship between the specific teeth and illness, temporal mandibular joint dysfunction, or TMJ or the TMD, neuromuscular body balance, pain syndrome, sleeping disorder, snoring, sleep apnea, autonomic nervous system balance, or OSB, which is the oral systemic balance. Likewise, contributing is the temporal mandibular joint dysfunction. Okay. Now, if you place anything inside the mouth, it doesn't stay in the mouth. When dental procedures done in your teeth or restorative materials placed inside your teeth, it doesn't not stay on your teeth. As you drink coffee, grind your food, swallow every single minute, mercury or metals leaches out of your restoration. How does the teeth connect to the mouth? To the circulatory system, digestive system, and the respiratory system. So where does your metals go? The number of dental metal alloys used since the 1980s has noticeably increased. More and more patients are being exposed to different dental materials. Often no practical knowledge about the potential hazards of the components of these materials. Meanwhile, research continues to present evidence of human risk caused by dental materials in the mouth, and more so with mercury fillings, which we will be discussing a bit later. We're talking about stool and urine challenges. Okay? These are the heavy metals, as you can see. You'll be amazed how these metals placed in your teeth will slowly creep in and slowly accumulate inside your body. Eventually, heavy metal toxicity starts to cripple and compromise your immune system. How many times have you stood looking right at the obvious, but were not able to see it? Sometimes we're so used with looking like us dentists. Our minds are programmed with what was taught, but now it is nice that we open our heart, our mind, to what this restoration may cause to your immune system. A lot of times, us dentists would, you wouldn't be a good dentist not unless you try to save the tooth. Don't pull out the teeth. As much as possible, do everything you can not to pull out. But one should, draw a line between saving and not to. There's no tooth worth saving if it's damaging your immune system. Biological dentistry, also called holistic dentistry, is a treatment approach or methodology within the dental profession that is concerned with the whole body effects of all dental materials, techniques, and procedures. It unites the best clinical practices, technologies of Western dentistry and medicine, and a wide array of healing modalities. We recognize other healing modalities such as traditional Chinese medicine, Ayurveda, homeopathy, energy medicine, food as medicine, and others. Other health professionals, other doctors would look at the eyes, others would look at the ears, the tongue. Us, we look at the teeth. You may even call us tooth whisperers if you wish. I just like you to understand how it goes, because sooner or later, I want all our doctors to look at the teeth and you slice, what you do is you place a medium line and divide the tooth into the upper right, upper left, lower right, 4 quadrants. We use a numbering system. From the middle, we go number 11, 12, go this way. This is how we're doing it here in the Philippines and also in Malaysia. 21 to 22 to 28, 31, 32 to 38, 41, 42, 48. So where is your right hand? That's your right hand. So this is your right side. So this is you looking at us now, okay? Later we'll conduct a small exercise so that you follow what I'm saying. The X-rays, this is a panoramic X-ray. So why is seeing the X-ray valuable? On the X-ray you see crowns, bridges, implants, root canals, and other significant, sometimes revealing body responses embedded underneath the bone. Like for example, so you see the crowns, root canals, the post, okay, extraction sites, wisdom teeth. This is the right side, that's why it's R, and this is your left side, okay? You will also come to see small specks of mercury, sometimes ignored during a procedure where mercury amalgam was placed now. Metal crowns. So this is a lot of metals. Nickel, chromium, cobalt, aluminum. This is a metal pose. Root canal has cadmium. So if you're thinking of other sources of heavy metals inside your body, well, dentistry has a lot to do with it. Mercury, mercury, mercury. You see, the human body is not just a physical being, but simultaneously it operates largely by a series of electrical impulses, which have been shown to follow certain pathways. The body are an entire network of these energetic pathways, better known as energy meridians. In traditional Chinese medicine, there is such a thing as meridian. Allow me to make it as simple, as simplified as possible. An analogy would be like a train passing from one station to the other. A station corresponds to one of your organ system connected to other station or organ system of your body. A station corresponds to one of your teeth connected to other organs of your body. Okay? Now let's look at the tooth and body connection, sometimes known as the tooth and the body energetic interrelation. The entire dentition is connected to 5 main meridians. First, the urogenital meridian, the liver gallbladder meridian, the large intestine lungs meridian, the stomach, thyroid meridian, heart, and small intestine. Let's look into it one by one. Your front teeth may affect your gonads, ovaries, testes, kidney, bladder, adrenal glands, hormones. Let's do a small exercise. Let's think about your teeth and follow the meridians. Okay? First, the shaded area. This is the upper right lateral incisor. So, you place a line in the middle, you count 1, 2 from the middle. Okay? This is the bladder meridian. Now, the organs connected to it is your kidney, your bladder, your urogenital system. Your pineal gland, your L2, your L3, S3, 4 and 5, spinal cord segments, L2 and 3, S4 and 5, your frontal sinus, your joints, your foot, your sacrum, coccyx, your knee, in other relations. Okay, same goes with your central incisor. If you happen to have a crown in your central incisor, check this meridian. If you happen to have an accident where you hit your front teeth, check your central incisor, this meridian. If you happen to have a lot of UTIs, incidences happening every once in a while, check your incisors. Same goes with the other side, basically at the same meridian. This is the upper left central incisor, the upper left lateral incisor. Now we go down. At the bottom, 4 incisors. This is the lower left second incisor. Was a root canal done? Do you notice any infection? Or you notice any gum inflammation? Same way with your lower left central incisor, lower right central incisor, and your right lateral incisor. The bladder meridian. Now we go next to the liver and gallbladder. This is the canine or your pang. It may affect your liver, your gallbladder, your major detox organ, the cuspids. If your patients appear with you and when they smile and you see some crowns in the front, that was the urogenital meridian before. Now, if you notice some modifications, restorations made at the cuspids, it may affect your liver. It's both the upper and the lower. See, this is the upper right. The organs affected besides the gallbladder and the liver meridian is the heart, the right side of the liver, because this is the right cuspid, and your gallbladder. It also may affect your pituitary and posterior lobe of your gland. Usually the cuspid is the eye meridian, okay? They call it the eye tooth. On the other side, you see it falls on the same meridian, the gallbladder and the liver, and the bile ducts may also be affected. The lower left include the lungs and the pancreas. Now, the gonads this time around may be affected. If any of you are practices acupuncture or chiropathy, they may check on some of these meridians too. The lower right cuspid also falls under this meridian. Now, we look at the bicuspids, or we look at the large intestines and the lungs. So what are the teeth that's connected to these lungs? It's your upper first and second bicuspids, or your premolars, and your lower first and second molars. So this time around, at the upper, these are the bicuspid. The lower, you have your molars. Okay? So not the bicuspids, but your molars. Okay? So the upper right, second bicuspid, may affect your large intestine, your right lung, your liver, large intestine, small intestine, gallbladder, duodenum. And all these glands, spines, sensory organs, joints connected to it. Later, there will be a chart that will show the teeth and the organs connected to it. Will be, you can approach my daughter, Dr. Vanessa, for details. This is the upper right first premolar. the upper left first premolar and the upper left second premolar. Also falling in the same meridian, but you would notice all the organs connected to it. Are there anybody practicing energy medicine devices or machines here? Yes. You would know, try to know which organ system is weak, and you match it with this. And you would know which particular tooth may affect that organ. So that's how we collaborate with our medical doctors. Okay? Now you have a guide. Your lower left second molar is connected to the large intestine meridian, the left lung, the large intestine, and same way with the other molars. Okay? Now, this is the teeth that affects the stomach and the thyroid meridian. This is the upper right first and second molar, the upper right and left first and second molar, and this time around is the lower bicuspids, both of them, the premolars. It affects the stomach, the thyroid, the parathyroid, kidneys, mammary glands. You connect the dots. You connect the dots. Okay, so look at your meridian, match it, and you'll know which organs, which tooth to look at if in case you find any disturbance or weakening of the organ system. It points to this meridian on the teeth, your patient's teeth. What to look for? Root canals, mercury amalgams, metals, dead teeth, infections, inflammations. Okay? So this is the bottom. First and second premolars. Okay. Now, this is the heart meridian, the heart and the small intestine meridian, which is your wisdom teeth. Okay? Your wisdom teeth may affect the heart, the blood pressure, the blood circulation, small intestine, duodenum, jejunum. So your upper right, third molar of your wisdom teeth, the duodenum, and the pituitary anterior lobe of the gland, inner ear, the maxillary sinus, upper extremities and the lower extremities, your shoulder joint, elbow, ulnar hands, plantar foot, toes, sacroiliac joint. Okay, same way with your upper left wisdom teeth, lower left wisdom teeth, and lower right wisdom teeth. Okay, you can find it also online. I'm not selling anything here with regards to this tooth chart online, but you can check this number if you wish. The human mind is like an umbrella. It functions best when open. My search to prove the safety of dental procedures like root canal and even the most basic of procedures like a tooth extraction led me to the International Academy of Biological Dentistry and Medicine and the International Academy of Oral Medicine and Toxicology. These are organizations that has stated goal to study the scientific evidence available on the safety of different dental materials. Root canal used to be part of my bread and butter. And so are amalgam fillings. But I took an oath to heal people, not to make them sick. So as I practice and mature on the practice and help cancer patients heal them, so I take notice on this metal toxicity infections that may affect their immune system. It is critical that the patients appreciate the relationship that exists between their mouth and the rest of the body, so they can participate better in their own treatment decisions. Most patients welcome this information. They feel more in control and less in the mercy of dental procedures. Our patients may have the right to be informed, the right to know their options. Biological significance of corrosive products used in dentistry. Galvanism. Galvanism occurs when two dissimilar metals are present in a fluid like amalgam next to gold crowns. Or a porcelain fused to metal crown next to a gold crown. Gold stimulates mercury. Okay? Corrosion, stress corrosions. Certain factors may influence dental amalgam corrosions. May it be under stress or not, the bottom line, all metals corrodes, all metals leaches out, and it's corroding inside your mouth. And every single time, every minute, you swallow. Friction and heat causes a rapid increase in the amount of mercury release, and this elevated level stays elevated for about 90 minutes and then gradually eases off. When gold is in the same mouth as amalgam, a battery will be created using the saliva in your mouth as the electrolyte. Mercury is released from all the fillings in your mouth 24/7. The dreaded root canal. Let's make it a bit basic. A root canal is performed when the nerve has been exposed by trauma, carious lesion, a cavity, or unexplained death of the nerve. An opening will be made on top of the tooth, and needle-like instruments will be inserted all the way to the tip of the root, and they would cut the nerve. And they will try their best to expand the canal, sterilize it, and seal it off. Or else anaerobic bacteria would set in. But the thing is, it's not that ideal. It's not that easy. You have accessory canals to deal with. And of course, remember those dentinal tubules that I was saying, just like small straws? You can seal. They try their best. They try their best to seal the canal, but you just can't seal the tubules. It's impossible. Where's the dentist? Yes, please. Am I right? We try to gain the hermetic seal, right? So we try our best to seal the canal. It's just like sealing the main highway, but there are service roads on the side. And they're quite ignoring the dentinal tubules. Now, if there's a vacant lot, people would squat. In this case, anaerobic bacteria, so they would produce very virulent toxins. And all they need to do is they create a territory of bacteria, and this is their highway of transport going to those connections that I mentioned a while ago. The blood vessels, lymphatic system, and nerves to the tooth are removed, and the filling material placed. Consequently, the protein exists in the dentinal tubules, will decompose, and toxins are forced into the periodontal ligament, right here. Periodontal ligament is basically just like the placenta of the tooth, okay? The tooth is dead with a root canal. They say, you saved the tooth, but actually they just killed the tooth. It's actually an oxymoron. They might have saved the tooth from being extracted, but they just killed the tooth. That's why afterwards you'll notice the teeth getting gray. Have you seen anything dead? A dead cat, a dead tree? I call it a root cadaver. And root canal is basically embalming. And they place a crown on top. So it's beautiful outside, but it's rotting inside. Have you tried pulling out a root canal? It stinks. It smells. It's black and gray. And you would notice underneath there are basements. Basements 1, basement 2, because those bacteria have settled from the teeth down under the root to the bone. Okay? All root canals are like time bombs waiting to explode. The connection was cut. Our body was created that it heals, it regenerates to our immune system. But now, those natural soldiers, those macrophages, cannot go inside you because you just cut. And this becomes a haven of bacteria. And where your immune system is down, you're deprived of sleep, you feel sick. That's the time, that's their opportunity to go out. Others are in the periodontal ligament and goes to your heart, and the heart pumps it out to those connections that I'm mentioning. How the body reacts. This is the tip of the root. You see those translucency at the tip of the root. It's just like this. This is your immune system working for you. It's just like building a great wall of China so that the pus, the bacteria, would be contained. Not to mention, your lymph nodes are there. These are natural filters. This is how amazing our immune system works. Okay? So just stay there. So sometimes you see a pimple-like opening happening in your gums. This is your immune system draining the pus, the abscess. Okay? Allow me. This is gutta percha. You see? They try their best to insert and seal the canal, but it's so hard. That's why sometimes it's overextended. It extends there. You see, endodontics is a specialty. It's so hard to call it a science because you insert needles and it's basically tactile. Tactile. So in an ideal world, they try their best to seal the canal, but it's not always ideal. This is where your body is trying to contain all those abscesses. And this is the mode of transport going to those stations or those organs that I'm telling you. This slide was shared by Dr. Glaros of Texas. Unextracted root canal treated teeth, number 8, 9, and 10, that was even lasered. Laser is used to sterilize it, eliminate bacteria. Was sent to the lab for in vitro toxicity testing. The report showed toxicity level at about 5. Extreme toxicity. You don't see this much open. This is from the body farm of Dr. Gary McCown, shared to us just to show you. The gums covers this. And when you flap the gums, just like removing the curtains, this is what you see. That's how virulent those bacteria are. On one reference from the Journal of Endodontics, Volume 41, Number 7, July 2015, entitled Correlation Between Volume of Apical Periodontitis Determined by Cone Beam Computed Tomography Analysis and the Endotoxins Levels Found in Primary Root Canal Infection. The data obtained revealed that the levels of endotoxins found causes bone destruction. Is in the same level, is reciprocating how big the bone destruction is. Slide shared by the medical director of the International Academy of Biological Dentistry Medicine, Dr. Dawn Ewing. She practices thermography and correlate it with the panoramic X-ray. You can do this and correlate with the tooth and body connection. That way, you're practicing dentistry and medicine. You're approaching the treatment approach holistically. In 2006, the X-ray evidence of infection in the pulps of root canal teeth was associated with more rapid appearance of coronary heart disease. Recent study on dental status of individuals who had already experienced myocardial infarction, finding more inflammatory process of endodontic or root canal origin in this group versus what was found in a healthy control group. Researchers is now pointing us to links between biofilms and cardiovascular diseases. Secondary infections can set up infections in any place in the body. Now you know which place in the body can those infections set up through the teeth and the body connection. So what to do with those root canal teeth? I cannot bring Lazarus back to life. When it's dead, it's dead. You bury the dead. You extract the tooth, do a complete debridement of the tooth, which means that you have to remove the periodontal ligament. You have to go down the basements, clean up the sock of bacteria. You will be amazed how big the scope of the area of the spread. Clean it up, ozonate, and then eventually you stitch it. Some biological dentists would do a root canal and treat it with ozone and do some materials like biocalyx. I do not. If you want to really see how your root canals are doing, go get a 3D cone beam, a CBCT. That way, what that is, if this were the root of your tooth, the X-ray will go around the tip of the root. A panoramic X-ray will show just this area. A CBCT would go around. That way you'll see that root canals remains infected. Don't just take my word for it. Do it, because this is your body. Ischemic bone diseases or cavitations. This basically means it's a dead bone from poor blood supply because you still left some of the periodontal ligaments inside. When you leave a periodontal ligament, it's just like telling the bone the tooth is still there. So you have to leave everything. You have to remove everything so that bone will slowly build up, regenerate. Cavitation may have either dead bone or bone marrow that has been slowly strangulated and nutrition starved. Voids in the bone. As far back as 1915, a dental pioneer, Dr. G.B. Black, considered bone necrosis to be typical of the cavitation lesion and to be the ongoing factor that resulted in the hollowed out area so often found at the site of an old tooth extraction. It means that the bone didn't really heal. Usually, when you open your mouth after several months, years of extraction, you thought everything was good on top of your gums. But when you remove the gums, there's still a hole underneath those bones. Yeah, allow me. I would like to have my practice mercury-free. We discuss a lot about mercury. A mercury or amalgam fillings. Amalgams contains 50% of liquid elemental mercury, 2% copper, 13% tin, zinc, 35% silver, and occasionally there's thallium and germanium. Mercury is a known acute neurotoxin. It is the most toxic, non-radioactive element and the most volatile heavy metal. It is the fourth most toxic substance known to science next to arsenic and lead. You mentioned the fourth, yes. Okay. So when you have your patients open their mouth, you look for amalgam. Notice corrosion on some areas. You can take a closer look on your teeth and check your amalgams. Others are shiny, others are corroded. As you take anything hot, brush your teeth, grind your food, it's corroding. It leaches out. And you swallow every single minute. Guess where it goes? The dentist would see this on the packaging of the alloys used in mercury. I don't know if they even look at it. Oh my God. See that guy there? Or the patients doesn't know this. They wouldn't see, but it's in the packaging. In our place, they banned thermometer, a lot of mercury things. But the only place where mercury is safe is inside your mouth. You see these side effects and warning, I can go on and on. Mercury doesn't have any specific effect. It has a general effect to your body. Poor memory, Alzheimer's, autism, it goes straight to your blood-brain barrier. It goes straight to your kidney, your liver. If you have patients exhibiting the following symptoms, consider looking inside your patient's mouth. Now that you've heard a lot about mercury, heavy metal, you just don't jump on the bandwagon and have those mercury amalgams removed by your favorite dentist. You would rather not touch those amalgam fillings if the operator or your dentist doesn't know what he's doing. Or else he will just drill on it, zzz, and you start swallowing. And you start inhaling mercury vapor, and he starts inhaling mercury vapor, and so with his staff. So we follow the protocol set by the International Academy of Oral Medicine and Toxicology. Likewise, the International Academy of Biological Dentistry and Medicine, which is, we covered the patient's nose with an oxygen source so that as we drill, she doesn't inhale mercury. Us, we were respirators. We have high respects to mercury, even my staff. The tooth is isolated with a rubber dam so that as we drill, he doesn't swallow mercury. And there's a high vacuum suction next to it. The patient is fully draped, and this is what we call an elephant suction. Air ionizer purifiers all around. We usually give zeolite as an immune system booster and a detoxifier before, during, and after the procedure. This protocol is designed to remove dental amalgam, crowns, bridges that appear to be biologically incompatible with the patient. After which, we do biocompatibility testing before we remove toxic metals, we remove toxic materials. We want to make sure that we bring in biocompatible materials so that we check for biocompatibility of the dental materials. Supplementation in the form of channel clearing supplements and homeopathics to support heavy metal removal may be recommended. So biological dentistry believes that whatever dental treatment performed must be biocompatible with the whole body and must not compromise general health and well-being. We utilize electrodermal screening, electroacupuncture according to VOD, EAB, for biocompatibility testing. Now, do you use it here? EDS, electrodermal screening for our doctors? Okay. This can be a device that can be helpful now. EDS is basically an energetic system. It can evaluate the functional condition and general health of the entire body, including determining the presence and absence of parasites, bacteria, fungi, viruses, and toxins. Compatibility testing through blood serum or reactivity test may also be recommended. It measures the degree of responsiveness between the person's serum and the separate components of commercial dental product. It indicates what materials may be suitable or for the patient to use in a restorative aspect of treatment procedure. Okay. Our holistic dental clinic believes that whatever dental treatment is performed must be biocompatible with the whole body and must not compromise your general health and well-being. As much as possible, we use metal-free restorations. Like yesterday, the distinguished German biological dentist mentioned about zirconium. We worry so much about the air that we breathe the polluted air that we breathe, the food, the pesticides, the chemicals that we eat. There's such a thing as treatment pollution or treatment pollutants. These are the treatment procedures done in medicine and dentistry. Now, this is an amalgam separator. We think also about the environment, or else it will seep in the communal water. I remember I did mention this to the minister while I have a chance to talk with them, because you have a beautiful garden already, a garden city. This, through the dental clinic, may pollute your beautiful garden city. So I would suggest having a amalgam separator in every clinic, because mercury, if there's a place where the source of mercury is in the dental clinic, okay, that may pollute the communal water. Okay. Again, the charts, so you can approach my daughter, Dr. Vanessa, later after the talk. We believe in food as medicine. We also correlate it with our treatment program. And these are good reading materials. Dr. Weston Price actually is a dentist, the best researcher. And his book, Nutrition and Physical Degeneration, points out on that food has a lot to do with the degeneration and even the teeth that causes a lot of things now, like malocclusion and all that. Our practice recognizes the importance of achieving a caring wellness environment where your body can heal itself, with the dental treatment being a significant part of the whole balance. To strive to work in harmony with the human body in its entirety, including mind and spirit. We also utilize homeopathics and, of course, vitamin C therapy. We collaborate with medical doctors. We use this before or after surgical procedures too. So just to conclude, I hope this would change how you look at teeth, dentists and doctors. Whenever you do your first assessment of your patient, do an oral examination, look for those metals, look for those root canals, connect those teeth with those organ system. Whatever organ system is kind of weak, that organ system may affect your teeth, and the tick may affect the organ system. Check the x-rays, and this way you can look for sources of infection. A perfectionist always seeks to do things the right way, but the ideal is to do the right thing the right way. So thank you very much.
Do we have any questions for Dr. Nelson Gaba? Of course, we have one from the dentist herself.
Yes. Hello.
Hello. Good afternoon, Dr. Gaba. I'm Dr. Adiba. I would like to ask you regarding, did you do the pulpotomy or pulpectomy in pediatric patients?
Pediatric?
Yeah, and
Okay.
peds patient, pulpectomy and pulpotomy. And what about toxicity of BPA in composite, and as well as fluoride in GIC?
Okay.
That's all.
Well, we try our best for your first question for children pulpotomy. We try our best first to do a basic filling, but if it doesn't work, yes, you may do that. Your second question basically is Oh, in a composite. Okay. There's still no all-natural filling material or any restoration. You want to use the least toxic among all these materials. And the least toxic would be composite. Composite may contain a bit of barium, but that's basically it now. And we find most of our patients, including cancer patients, that it's still biocompatible. Okay? And your last question is? Fluoride. We don't use fluoride because we find it also toxic. We can do in-depth discussion in all this if we can do a workshop one of these days. And I'll be more willing to share all this information. Very good. Fluoride, yes. Thank you.
Excuse me. I was just wondering, when a person uses the dentures, the braces, does the metal in the mouth actually affects them?
Okay. The brackets and what you call the arch wire contains nickel. Nickel is also carcinogenic. It depends on the immune system of the individual. It depends on, if it's highly sensitive and all that. So if you're asking me, in terms of toxicity, there is nickel in arch wires. The arch wire also contains nickel titanium. Okay. So metals interfere with you see, we're bioelectrical. It may also interfere with with the normal flow of electricity in our body. So, yeah. Okay. Did that answer your question? Yes, please.
Because my daughter, she's 29 years old. She's just put up the braces. And I noticed for the past 2 months, she's been losing weight, feeling very tired, unable to sleep. So I was just wondering whether it's that, because previously she has it, but it didn't affect her like that.
Yeah, that's what I'm trying to say here. Try to connect the dots. Was a dental procedure done? And then, okay, you feel something different. Then you ask, was there a dental procedure done before feeling something different? You listen to your body. So sometimes this is your body's way of telling you, you might have placed something in me that I'm not responding very well. So this will answer your question. Yes.
I'm Dr. Kenny Yong from Malaysia. I want to ask you questions regarding the amalgam, detection of the amalgam. Is it true that you cannot remove all the amalgam in one shot, that you have to do it 1 a month or 2 a month maximum? Do you go by per quadrant approach, or you do 2 per month? Is there a limit?
Okay. The way we do it is we collaborate with medical doctors. They do this electrodermal screening, or any energy medicine equipment device that will tell me which organ system is weak. Then I do the connection, and this will tell me which area of the body, is it the left or the right that is weak, which organ system, and this is where I start. Now, I cannot transfer from one side to the other. If there are a lot of, mercury amalgams in one quadrant, I can finish that. But it depends on the immune system. It depends on how weak he is or how strong he is at that time. Okay? So, we go by quadrant. If it's strong enough to do it, maybe we go from upper right to upper left to lower left before we transfer to the other side.
There is a doctor in the US, Dr. Simon Yu. He was doing this kind of test, and is this the same test that you're talking about, that you can do the meridian testing and then to find out the conductivity and the evaporation, the galvanism of that different sizes of the amalgam and number them, and then you remove the weakest one or the strongest one first?
Yes, this is another device you're telling me. Others will do that but I do with, I approach it with energy medicine device now. So that's why I collaborate with my doctors. So I go with what's the organ system that's weak and help that area, help that organ, and then I check the connection. So that way I'm just doing, the tooth that's connected to that particular organ.
The USA Simon Yu machine was doing testing on the machine, on the patient, and then it will, while the patient is hooked on, there is also a probe to touch the amalgam. So your method is to do the meridian test on the patient itself. The energy test was done on the patient's body, not on the tooth then, is it? Your method?
Remember, it's connected.
Okay, so yours is nothing intraoral. The test is not done intraoral, right?
What?
Your test, I mean your
Yes, my
your
approach is basically this type now. Electrodermal screening, EAV, and all that.
Okay.
The body.
Okay, thank you.
The body, thank you.
And okay.
Sorry, Doctor. Expanding from Kenny's question, so how do you determine how many amalgam to remove per session?
Oh, okay. If one quadrant has one or two, I do both of them on one quadrant. Okay, one quadrant. So, but then I don't do it all together at one time and in between sessions. Okay, so and I send them to the doctor, which I collaborate with and check his immune system, the readings, and from there I restart again. So it's in constant collaboration with the doctor and with the readings now. That's how I do things. Not just, you see, it's no one formula for everybody. I monitor the meridians. There's no set of rule, to follow. I listen to the patient's body through this energy machine, okay, in collaboration with the doctors. Okay? Yeah. Okay. Usually what the doctors would do, they send in patients to me. So they do a machine testing. They would know which area through an energy medicine machine, which area or organ is weak, and they give me the results. I check the results, do assessment of the teeth, check the x-ray, check the connections, and from there I would know which area to start on. Are you following me now? Yes, okay. That's how we do things. It's not just looking at it. They said, can you do this? And I do that. No, it's not that way. Okay? We approach it holistically.
Thank you, Dr. Nelson.
Okay.
All right, we shall invite.
Yes, let me just give you in connection to his lecture. And this is kind of, we're envious with you guys because you've been getting special offers. We don't get this in the Philippines, but there is a special offer for the Malaysians. Those that are interested in becoming a member for the International Academy of Biological Dentistry and Medicine, an application form is available, and from a membership fee of $495, it was brought down to $295. So it's a $200 discount. And there is, I believe, only about 20 of the tooth and body connection chart that is available. Those that are interested to avail of these, Dr. Vanessa is over there. She's got all the forms and the chart as well. Okay, thank you. Now, can we call on Dr. Madzia and Dr. Homer Lim for the token of appreciation for Dr. Gaba?
go first.
Big bang.
Okay.
All right, thank you then.
Thank you.
Okay,
Can I
thank
check?
you.
Can I check first? Do you want to go for break or do you want to continue the last lecture? Can we vote?